because we have at least Beatrice not here and more than just Beatrice. Okay, so flexion is a decrease in joint angle and extension is an increase in joint angle. And last week we all reviewed, and it seemed as if we were awake at that point, that like a straight line is how many degrees geometry? 180, right? And then like this is like 90, right? So we're going from 180 to 90. You can see those numbers are decreasing, right? So that is flexion. And then an increase in joint angle is extension. That makes sense in most joints that we're looking at. There are a few that sometimes people feel are a little more confusing, but let's start where it's not confusing. So at the spine, there's actually a lot of little joints in the vertebra. And when we study the spine, we'll look at that in detail. But basically, like if you're doing a crunch or a sit up is flexion. And then like a back bend is, or standing up is extension. Technically, if you get past the midline, and that would be hyperextension, but it's really not wrong to just say extension the whole time. When we go, and we talked about the planes last time too, right? So picture what plane you're in when you're flexing and extending. Beautiful. Yeah, Sagittarius. I'm a Sag. Yeah. Yay, Sages. Yeah, good job, sagittal. Excellent. So, okay, and then rotation of the spine is like when you're twisting right and left, that's rotation. And then lateral flexion is that right side to side. Whee, lateral flexion.
So bending the body away from the midline.
Exactly. Okay. Yeah. And you pretty much just have to say to the left or right for that one. All right, and then the neck is pretty much the same. So we can flex the neck forward. Sometimes people say head and neck, extend it backwards. So flexion is chin to chest. Extension is chin up to the sky. Rotation is like you're shaking your head, no. So your nose to the side, to the side. And then your lateral flexion is your ear to your shoulder. Now, one thing I will say, because there are certain massage techniques where either the massage therapist is putting the client in those movements or asking the client to do those movements, is that, you know, this is probably common sense, but after a while, you're going to get so used to these terms that you'll think everyone knows them, and they don't. So just give clients directions that are like, put, you know, your ear towards your shoulder. Don't tell them to laterally flex, you know. All right, questions so far? All right, your rib cage or your thorax, elevation or expansion, basically going up and out when you inhale, and depression or collapsion, basically going down when you exhale. As I mentioned last week, there's actually some other cool little movements going on in the ribs, but that's kind of a more advanced, exciting lecture for later. We got to save some good stuff, right? Second quarter, we got to make second quarter fun.
Right. Because otherwise, what else would we do?
The scapula, which some people call shoulder blades, that the scapula is their formal name. Let's see if we can make those a little bigger. When the scapula go up towards your ears, so those flat bones in the back of your, behind your, on your back next to your spine, when those go up towards your ears, that's elevation. And when those go down away from your ears, that's depression. So you probably noticed in yourself, your loved ones, whoever's like, I want a massage, that, you know, people get their shoulders all jacked up, right? So when we're tense, lots of us are in elevation. So little preview to where we're going, those are the muscles that are like overworking, the ones that are pulling us up into elevation. So then I'm in this top middle picture now, this dude rock climbing. He's just posing. He's not really rock climbing. He's just like on a wall. Like, he's not look like he's rock climbing. Dude would not be doing that. Anyway, this poser has his scapula. See the arrows going to the mid sagittal. When the scapula go towards the midline, it's adduction. And remember, it starts with the prefix add, so it's like adding to the middle. And I mentioned massage teachers, maybe anatomy teachers, if they use these words a lot, will often say adduction and abduction, just because those words sound so similar, but that's not how you pronounce it. You pronounce it adduction and abduction. So then when those scapula, and this one has two words, and sometimes the two words are not as important, but in this case they are. So you will hear both terms a lot. So you can call the shoulder blades going towards the midline adduction, and you can also call it retraction. Now this picture, and we'll talk about this more when we get into the scapula details, which is exciting. I love the shoulder. It makes it look like a very simple two-dimensional slidey motion, but it's pretty darn cool. We all know our rib cage is actually curved, and the scapula are actually curving around forward and curving around backwards. It's not really like a little straight line. Abduction, where did you go? Oh, there it is. Thank you. On the punch, the right punch. So when the scapula comes to the side and forward, that is protraction or abduction. So it's going away from the midline, and it's also going forward. It's going around that rib cage. And like this picture, when you throw a punch, that scapula comes forward. Like we talked about last week, sometimes all these movements look like they're coming just from the arm, but like the arm can only go up 90 degrees and it can only go like so. But if you want to really reach things and move around or even go overhead, all of that is really the scapula moving quite a lot. And even this clavicle, if you touch your own clavicle and you start moving your arm around, and you can hold on to it because it's a little S-shaped bone. If you hold on to it and you move your arm, you should feel that it actually moves around a lot. So something to keep in mind, because lots and lots and lots of your clients need, they've got tight shoulders, even frozen shoulder is really common. So you'll be working around this a lot. What's that?
Frozen shoulder.
Yeah, I knew I'd get into trouble if I said too much. I've said too much. Yeah, it's a medical condition that's pretty common with people who are like, other people can get it too, but I would say it's most common with people who are like 50 and up, and kind of their whole shoulder blade complex gets, just like the name sounds, frozen, and their motions get really limited, and it can last years. So you'll have people come to you for massage for that, for sure.
Is that just the muscles like shocked, or just bad movements are like,
Yeah, he's asking kind of like, is it like the muscles knotted or tangled or shot? Or it's a great question. There are certain medical conditions that are called idiopathic, which just means we don't exactly know the cause of it. And frozen shoulder is a little bit mysterious, but it's not just like, it's not just knots, and it's not just weak muscles. Yeah.
Just out of curiosity, what keeps your scapula like attached? Is it all tendon that like pulls it, or like what keeps it from like
just flying off?
Yeah.
Yeah. And sometimes it does, right? No, I'm just thinking about that. I was thinking about that Red Bull with wings that we were talking about yesterday. Yeah, that's a great question. Like I mentioned last week, you had the great question of like, where is it actually attached? And that whole shoulder complex is only attached right here, which is pretty amazing. It blew my mind the first time.
That makes no sense.
Yeah, but there's all these big, strong muscles. So we're going to and tendons and ligaments. So it's a combination of muscles, tendons, and ligaments. And you'll see, we'll study that there's muscles pretty much coming from every surface of it. So, but some of them can get like weak. It could be a nerve not firing thing. And so have y'all seen, or maybe you personally have this, maybe you've experienced it, seen it at gym or someone you play sports with, where their scapula just like pop right off? Yeah, so it's called like a winged scapula if the medial border just boop, you know, so some people, there's not as much stability there. Yeah. Usually it's not a painful thing for them. Yeah, yeah.
What?
But you'll see,
I'm gonna lose, like, shoulder blade.
yeah,
Aliens.
it could be. No, I do not know the cause. Sometimes I think my bees are little aliens. Anyway, that's not for today's lecture. That's not for today's lecture. And after all, I am recording.
Hey, Zefire, what did you have for breakfast today?
I did take a walk in the woods. Maybe that was it. I did forest bathing. I was opening all my
Yeah, I think every
senses.
time she does, they do the forest bathing, yeah.
A little wacky that day, right? Yeah, no, but there was a serious topic related to the shoulders, blah, 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 blah. I don't remember.
Can I just mention something cool? about
Yeah,
that?
yeah.
Eventually, we're gonna be getting like all under the scapula and we'll be able
I
to
was
like. pull it
just
in.
wondering
Oh, no. I don't want to do that.
It feels so good. It feels so good.
You'll see it in a lot of our videos. Elizabeth, that is actually what I was going to talk about. Because when you guys were like thinking about people's who pop off, you will see a big difference even just in this room. Like some people's are like super mobile and you can get right under there, and others are like kind of more cemented on. And so yeah, a lot of variation.
You can actually get like under.
Yeah.
I don't wanna, like,
Yeah.
that's like
Yeah.
giving me a lot of nerves right now. Like,
No, it
it's
usually
like
feels good.
racking.
Man, I want that done right now.
Is it possible?
You can get it.
Really?
Yeah, just boop, pop it out. Just, you know, like cracking a can.
Oh my God.
Okay, now you've scared them.
Now they're awake.
Trying to think of
Hmm.
While someone was running.
Oh, ouch. Yeah, no, this is not like that because you're not actually disrupting any joints. You're just freeing up some tightness. Yeah.
They can stay tight. I'm recommend them to you guys.
Well, you know, I know it's kind of coming up in a funny context, but it is interesting that you kind of say that, right? Like they can stay tight, because I think it's good to start thinking about like not everyone really has the same goals or needs with like how loose or tight they want to get, right? Like, so think of the difference between if somebody did circus arts or gymnastics versus like somebody on the front line of offense or defense in American football. Like you don't want, you know, the center to be as loose as someone from Cirque du Soleil. They would get hurt.
No, yeah, they're gonna get rid down for sure.
Yeah, they need that to not pop out of place.
I like seeing that happen Monday Night Football.
Speaking of which, is 2-0 okay? 2-0?
I don't know, but my son was talking about.
But I know Brady's getting divorced.
Wow.
Wasn't it at the back of it?
This last one is where the scapula actually twists. So it focus on what the outside or lateral side is doing. Yeah, exactly like that. So when it goes like that, it's downward, and when it goes like that, it's upward.
I found two.
You did. You're
Oh
my
God,
hero.
you guys took those from somebody?
They're plastic. You can have one.
They were very flexible.
Yeah.
Check me out.
It's like, I'm
Would you ever have that?
Have what?
Like if someone donated like a full
Oh, yeah.
hospital, would you?
Yeah.
Would you?
I mean, people do sell them also. You can buy plastic bones or real bones. The real ones are very expensive.
I would
Yeah.
hope so.
Yeah.
Yeah, we just have plastic. The real ones are kind of cool how you can see like the texture of them.
Of course.
I
Yeah.
own one human bone.
You don't?
You do.
I own
All right, so on the scapula, we're looking at the posterior from the back view. And this side right here is towards the spine, so the midline. And this side right here is toward the shoulder.
Okay, so the
And-
lateral.
Yeah, so here's the spine where my other hand is, yeah. So when this goes down like that is downward rotation. And when it goes like this is upward rotation. So again, your arm can only go up to 90. So if you go higher than 90 degrees, this is happening because the scapula is upwardly rotating. And then when you put your arm behind your back, the scapula is downwardly rotating. And then the other ones are pretty straightforward, just a quick review. Elevation, depression is towards the midline is retraction or adduction, and towards the front and away from the spine is protraction. So questions on those?
Yes.
Yeah,
So if so they can do both at the same time, right?
yeah, for
Okay.
sure. Yeah.
And I was like, yeah, so when, the left shoulder's up and this one is in downward and this is in upward.
Yep,
Okay.
yeah. Yeah, they can both do the same thing at the same time or opposite things at the same time. Yeah. And we will definitely, even today, we're going to look at combined movements. All right, let's go back to the next movements. So the arm at the shoulder, which is called the glenohumeral joint. This is one of the two ball joints in the body. And so it allows movements in all planes. And, sometimes it's easy to like look at what is doing the kind of looks like it's moving the most, but you have to look at where the movement is coming from the joint. So for example, when the arm comes forward, it looks like the arm is moving, but that movement comes from the shoulder, the ball and socket. So when the arm comes forward is flexion. When arm goes backwards, it's extension. Technically behind the body is hyperextension, but it's really okay to call the whole thing extension. When they come out to the side is abduction, abduction. And when they come back towards the center, back towards the body is adduction, like adding to the midline, or AB, abduct, to take away. And then horizontal, like horizon, the movement is on the horizon towards the midline. Again, we're adding to the midline is adduction, and then away from the midline is abduction. And then this last one can sometimes be a little harder for folks to grasp. We looked at it last week. Let's look at it again. When the shoulder comes in towards the middle is medial rotation or internal rotation. And when the shoulder goes out is lateral rotation or external rotation. In this case, they show the elbow bent, but you can do this movement whether or not the elbow is bent. So try doing it on yourself and see if you can get that twisty motion of your arm. Questions on those? All right. What's that? Did you say TikTok? Do you have a TikTok thing going on? Oh, there you go. All right, I mentioned on these drawings, sometimes the drawings are a little confusing, like what are they showing moving? Look at the little dot, especially if you're doing a worksheet or something. So in this upper left, we have flexion of the elbow. So a decrease of joint angle, right? Like if you're doing a curl. And then extension is that elbow coming back down. And then the forearm, if the thumb twists up towards the top is supination, excuse me, the thumb turns out laterally and up is supination. And if the thumb turns down medially is pronation. And remember, people remember like supination, like soup, but this only works if you picture anatomical position. We looked at this on the skeleton last week. When you break off into your small groups, I recommend looking at a skeleton model. Excuse me. Because it's kind of cool where the supination and pronation occurs. So the flexion and extension occurs at this joint right here, which is shaped like a C, and then the bone fits very tightly in that C shape. But this little spinning wheel right here allows this spinning of the thumb, missing thumb. Imagine the thumb to spin down over. And so these bones actually twist.
So it's the radius that does the twisting.
Um,
Ulna just kind of is locked where it is.
Precisely, yeah. So the ulna is stuck in place as this, and then the radius twists over. Yeah.
Is it the same for the bones?
Great question. They're arranged in a similar manner, but because we need more stability on the leg, they don't allow that same twisting motion. That'd be cool though. We could do all kind of fun things. In my next, I don't know. All right. Any questions on those ones? All right, the hand, the wrist, excuse me. Imagine anatomical position. If the hand comes up forward, that's flexion of the wrist. If it goes back down is extension. And then there's a side to side motion. And so if the thumbs go away from the midline is abduction. And if the thumbs go towards the midline is adduction. Remember to be in anatomical position, or you could reverse that. So always think palms forward. And then this one also has two names, which makes more sense when you lock it into your mind that the thumb side is the radial side and the pinky side is the ulna side. Do you have good mnemonics for that?
I don't, I'm still back at supination.
Okay, holding bowl of soup.
My little soup.
All right, we're almost there. The hand pictures get kind of confusing. And I think they're really, the main ones we want to look at is all the joints of the fingers and toes can all bend. When they bend forward and the angles decrease is flexion, like you're making a fist. And when they open up, like you're opening your hand, is extension. You can move your fingers closer together is adduction, and spreading them apart is abduction. And then the unique one to the thumb is that the thumb can go across, right? And to reach the other side of the hand is opposition. And really, if the thumb reaches across to other fingers is opposition as well.
Because we have an opposable thumb.
There you go.
Wow.
Yeah.
Put that down like that.
Yeah, I didn't either.
Yeah.
Like, I definitely didn't know it was this opposite
I'm so
sides.
glad you
I was
did
like-
Nicole has a question.
Oh, yeah, during extension, how come you can't stay in lateral extension?
Because it's moving towards the midline, wouldn't
Yes.
it be medial because in the anatomical position?
Well, the thumb
Yeah,
can
one-
extend in many different directions, not
Right.
just laterally.
Oh,
It's a good question. Let me
Yeah.
think about that one.
My abduction and extension. It's a great- I was wondering that, yeah.
And then the fingers are basically the same, except for not the opposition. And then the jaw or the mandible. When you close your mouth, when the jaw goes up is elevation. When you open your mouth, the jaw goes down, the mandible goes down is depression. When you move it forward is protraction. When you move it backwards is retraction, and side to side is lateral deviation. Now, some of these come up, more than others in massage, but we're going to run through all of them at first. The pelvis, this picture on the left with the arrows showing that the belly side, right, is gonna, when this rolls forward, is anterior tilt or downward rotation. And then when this rolls backwards is a posterior tilt or upward rotation. And we can do that in some of our, movements intentionally.
Like twerking.
Yeah.
Definitely, for sure. Yeah, for sure. And, but also posturally, people get held in certain position in their pelvis, which mostly is people stuck in anterior tilt. So when people are stuck in anterior tilt, that increases this curve of the low back. So a lot of people have that going on.
It makes you flatter in the front and bigger in the back. So a lot of people tend to
Big curve
Tilt their-
on purpose.
tilt their pelvis forward.
I'm biting myself. Sorry.
And then the hips can go up side to side. That's called lateral tilt. You've got these great muscles, the quadratus lumborum in the back that can pull up side to side. You do this just walking, you do this holding something on one side, a bag, a kid, whatever, dancing, like lots of moves. What's that?
Instead of a bag or a kid, I'm like, yeah, same thing.
Right?
It's bad.
Yeah.
People also tend to do this like when they're sitting, like you sit on the couch. If you have your spot on the couch and you tend to like lean, you'll have one side that's short and one side that's extended. And that can cause a lot of like postural issues later on. If you do that.
I feel like you're calling me out right now. You know my sofa corner.
Love being in a fetal position.
I used to set my wallet in my
That's very
back pocket.
true.
If you're a
And, after
gymnast
while, I think I just
and you're
said,
lifting your
my
like,
ass hard just a little
is your
My
is
chiropractor
the
will
hip
stop doing
going lateral and your leg going up at the same time?
Yeah, and it would be posteriorly rotating also. Yeah, although the leg does have impressive range of motion. If you're a gymnast, mine does not have impressive range of motion.
You just gotta touch it.
All right, so the hip motions, again, like the shoulder, it's a ball and socket joint, so it can move in all directions.
happy side.
So upper left here, when the leg comes forward, if the movement is coming from the hip, is flexion of the hip. Oftentimes we're, extending the knee at the same time we're flexing the hip, but just the movement at the hip is flexion. Then on the lower left, when the hip goes backwards is extension. And we can do this like it's easier to picture this motion when the foot leaves the ground, which is called an open kinetic chain, but we can do that same motion when the feet stay on the ground as well, which is a little harder to picture, but the same movement can happen at the hip either way. And that's called a closed chain. Harder to picture, but those movements happen too. When the legs go out to the side away from the midline is abduction or abduction, like a jumping jack. And when when the legs come back to the midline is adduction. And of course you can do one or both at the same time. Yeah. And then at the hip, you can also have the hip turn in just like the shoulder, medial rotation or internal rotation. And again, we looked at this last week where the leg can be confusing on this one. The leg can look like it's backwards. But if you focus on the hip movement, which I can show you on a skeleton and me in a minute. And same thing with lateral rotation, turning away from the midline. So I don't really have our owly on. Well, let me at least change cameras for that. See if we can get this in there. Nope, it's not gonna be easy. But if this hip turns inwards like so is medial rotation, and when it comes out like that, it's lateral rotation. But you can see if you bend the knee, while you do it, it looks backwards because this is internal rotation, yeah, of the hip. And this is external rotation of the hip. So,
The name of it is more so from the reference of like the femoral head.
yes,
That'd be the where you're really categorizing it from. not-
Yeah.
The joint that you're talking about specifically.
Yeah, that's where that's where that movement is coming from. And the leg is, the knee is basically just going along for the ride. It can't really,
It doesn't have a mind of its own.
It's kind of sad.
yeah.
Here for a good time. Yeah.
When they break off the practice, if you need a view of that, I can zoom in, but that was hard to do. All right, so we're almost there. The knee is primarily a hinge joint. It has a little rotational movement, but it kind of just unlocks the knee. It's really primarily a hinge joint. So when the joint angle decreases is flexion. So this may look backwards to you. This upper left picture is flexion. But again, keep in mind, that's the direction that the joint angle is getting smaller. And then when you kick a ball and the leg goes straight is extension. Does that one make sense? And the medial and lateral rotation is not a big movement like the hip and shoulders. It's just like a little movement that helps unlock the knee. Yeah, for sure. Do you have any other better way to describe the rotation of the knee?
What is the natural movement of, like your knee is supposed to do that, right?
Yes.
Okay. Is that like uneven terrain and like micro? Like it's so small you can't.
Yeah, it's micro movements. Yeah.
I mean, and it's also gonna be the movement you do when you're driving. So you're gonna do that,
Pedaling, right?
yeah, so when you're using the pedal, you're going to do that medial rotation to hit the brake and the lateral rotation to hit the gas. So you do that movement all the time, but it's very small.
Right.
Thank you. That's a great example.
Oh, the crossover effort.
Yeah. Yeah. So move, it does move the lower leg a little bit to do that.
And if you've ever like injured your knee and still somehow have to drive, you notice how exhausting it is because you start using your hip to compensate.
Oh, thank
So that
goodness,
you can move like your whole leg back and forth.
So it's kind of similar to the forearm, because there's two bones down there,
Yeah, no,
Well, it's not coming from the two bones though. It's coming from the knee.
Oh.
Yeah. And in the forearm, it's coming from the two bones
Interesting.
rolling over each other. Well, one rolling over the other.
Right.
All right, and last but not least, the foot and ankle. When the ankle comes up is dorsiflexion, which it looks like the foot's coming up. The dorsal surface of the foot comes up, dorsiflexion. And when the foot goes down, movement from the ankle, plantar flexion, like you're planting your foot, or the foot going towards plants. Like this is you're putting your foot on the gas. When the inside of the foot goes up is inversion, and when the outside of the foot goes up is eversion. When the toes curl is flexion, and when the toes open is extension. Very similar joints to the fingers. So that's all the basic movements. Do you have any questions?
Yes.
Mhm.
What is it? Because I do not stand straight at all. Like when I stand, my knees go straight backwards. What is that?
When the knees go too much backwards is called hyperextension, and that your body is having to balance in gravity. And everybody is kind of making these compensations. So some people like lean too far forward, and then their knees are hyperextending to compensate. And then your pelvis might be tilted too far forward. And so everything upstream and downstream is compensating.
I've been like that all my life.
We're all messed up.
You
know,
Our special day.
You know, what I like to like think about, like even Olympic athletes who are looking at video of themselves and studying and perfecting their movements still have their idiosyncrasies and differences and imbalances in their body. Some of them make them freakishly good at their sport, right? Like if they're designed anatomically to have freakishly amazing lats, then they're a powerful swimmer. But we all have our, none of us are really like perfect in gravity.
A really good demonstration is if you all remember, like, so you think you can dance, or like those kind of shows. where it's like, yeah. A lot of dance stuff like ballet, you're looking at the lines of the body. So when you see people that the extensions of their feet or their arms and stuff, they're actually keeping track of the length of the line of where it's coming along. And that's how you get all the beautiful movements and all that fun stuff too.
Mm.
Yeah, I don't pay attention to nothing.
Ballet is super
Yeah,
obvious.
that's like,
Yeah.
super culture. It's like, that's a lot of fun.
Yeah, but once you get this terminology down, ballet terminology makes a lot more sense. If you're not familiar with ballet, you can not. That's like, I watch ballet videos on YouTube sometimes. I'm like, okay, that does make sense.
Yeah. And, it's great that you're like making these connections and thinking already, but like over time, we're definitely going to look more and more at like, implications and, as we learn all the muscles and fascia, like what's going on, because many of like the ones you're describing are just like super common. And warning, like it's going to totally change your people watching, because you're just going to see like where they're jacked up and where their posture's off and what kind of massage they need. And
You can also kind of tell what kind of motions that people do just from watching them walk and stuff. Like you can tell like where certain restrictions are in the muscles. You're like, oh, they clearly work in a construction site because of the way that their shoulder is set up. They're like in a constant jackhammer position. Or you can tell if somebody does a lot of more fluid work and stuff, because their gait will just be so smooth and almost like soundless, and there won't be any kind of like disruption. Yeah. There's martial artists, so that they do ballet